In fact, last week, our hospitalizations rose for the first time in 19 weeks. So we had 18 weeks in a row where our hospitalizations were declining, and then last week they rose. And last week, our positivity rate for the state went above 5% for the first time in 8 weeks. So we are seeing more virus out there in the community. So please continue to use the tools we've given everybody to slow the spread of the virus. That means keep your 6 foot of distance when you're out in public from other people. Wear a mask if you can't do that when you go into the store. Wash your hands often. Avoid the 3 C's. Those close contacts, confined spaces, crowded places. Those are all things that will continue or contribute to the spread of the virus. So we want to remind people that the virus is out there. We have seen an increasing in hospitalizations week over week for the first time in 18 weeks. So please continue to take care with regard to slowing the spread of the virus, even as we get more people vaccinated. Now, with regard to the vaccines, we did hear on the White House call last week that the country as a whole will be receiving 5.1 million doses of Johnson & Johnson, which is more than double from the previous week. And here in Nebraska, that means that we'll have about 27,600 doses of Johnson & Johnson. You put that together with the 25,740 Pfizer and the 19,200 Moderna, and you've got 72,500 doses that we will have here in the state this week. The federal pharmacy program is also expanding, and that is going from 17,000 pharmacies nationwide to 40,000 nationwide. We don't have good insight here in the state exactly what that means for us with regard to the number of doses, but you can imagine that if the state allocation is going up to 27,000, that we may see a similar number in pharmacies as well. So you can, obviously, we want people to sign up at vaccinate.ne.gov or call 1-833, it's toll free, 1-833-998-2275 to get signed up. We are in phase 2B throughout the entire state, that is open for health departments. So that means anybody who is 16 and older for Pfizer, 18 and older for Johnson & Johnson, Moderna, can get that vaccine. Now, that doesn't mean your local health department is necessarily in those age categories. They may be at age 40, for example. But it does mean that that option is out there, and that will be the case at all the pharmacies for the federal program, that they'll be doing 18 years old and up. So you can check with the state, sign up at vaccinate.ne.gov. You can look at your local pharmacy, see if they've got slots that are available for scheduling. But please get signed up to get vaccinated, because ultimately that's how we get through this pandemic, is by getting people vaccinated.